The United States has the highest maternal mortality rate among developed countries, and also ranks poorly on other indicators of maternal and infant health, such as preterm births, low birth weight, and infant mortality. These outcomes are not evenly distributed across the population, but reflect stark racial and ethnic disparities that are rooted in systemic racism and social determinants of health. To address this crisis, we need to implement evidence-based solutions and policies that can improve the quality and accessibility of maternity care, support women's health and well-being before, during, and after pregnancy, and reduce the barriers and inequities that affect maternal and infant health outcomes. One of the potential solutions is to increase the availability and integration of midwives in the maternity care workforce. Midwives are trained professionals who provide comprehensive prenatal, intrapartum, and postpartum care to women with low-risk pregnancies. They can work in various settings, such as hospitals, birth centers, or homes, and collaborate with obstetricians, gynecologists, and other healthcare providers when needed. Studies have shown that midwifery care is associated with better maternal and neonatal outcomes, including lower maternal mortality and morbidity and reduced stillbirths and preterm births. Midwifery care is also more efficient and cost-effective, as it reduces the use of unnecessary and potentially harmful interventions like cesarean sections, epidurals, and instrument-assisted births. However, the U.S. has a relative undersupply of midwives compared to other high-income countries. In 2018, there were only 13.9 midwives for every 1,000 live births in the U.S., while the average among OECD countries was 74.1. Moreover, midwives face regulatory, educational, and financial barriers that limit their scope of practice and autonomy in some states. To increase the availability and integration of midwives in the U.S., we need to adopt policies that support their education and training, expand their scope of practice and reimbursement, and facilitate their collaboration with other healthcare providers. Another potential solution is to improve access to postpartum care and social supports for women after giving birth. The postpartum period is a critical time for both mothers and babies, as they face physical, emotional, and social changes and challenges. Many maternal deaths occur in the postpartum period, especially among women of color. Postpartum care can help prevent or detect complications, such as hemorrhage, infection, hypertension, or depression, and provide counseling on breastfeeding, contraception, and chronic disease management. Social supports can also help mothers cope with stress, isolation, or financial hardship that may affect their health and well-being. However, the U.S. is the only high-income country that does not guarantee access to provider home visits or paid parental leave in the postpartum period. The standard postpartum care in the U.S. consists of a single visit 6 weeks after delivery, which may be too late or insufficient for some women. Moreover, many women face barriers to accessing postpartum care, such as lack of insurance coverage, transportation, child care, or cultural competence. To improve access to postpartum care and social supports in the U.S., we need to adopt policies that extend Medicaid coverage for pregnant women beyond 60 days postpartum, provide universal access to home visiting programs, mandate paid parental leave for at least 12 weeks, and ensure that postpartum care is individualized, continuous, and comprehensive. These are just some of the potential solutions and policies that can improve maternal and infant health outcomes in the U.S. There are many other factors that influence these outcomes, such as preconception health, prenatal care, quality improvement initiatives, racial justice interventions, and social determinants of health. To address this complex and multifaceted issue, we need a coordinated, collaborative, and holistic approach that involves all stakeholders, including policymakers, healthcare providers, public health agencies, community organizations, and women themselves. Together, we can make pregnancy and childbirth safer and healthier for all mothers and babies in America.